Massy Mutumba is new to St. Louis, joining WashU's School of Public Health. The school itself is new too, opening in 2025. In fact, the School of Public Health is Washington University's first new school in 100 years, located in the Cortex Innovation District in St. Louis. The goal is to meet current and future challenges in public health in St. Louis and globally.
It's really an exciting opportunity to be part of something new and innovative. I think the school holds quite a lot of potential to be one of the best schools in the country and really transforming healthcare, not just here in St. Louis or nationally, but also globally.
Mutumba's focus is on youth suicide.
One of the key motivations was to do my work on suicide among children in St. Louis area. It's kind of hard to do that from a distance.
Youth suicide rates have climbed at an alarming rate. Mutumba says youth suicide is a serious public health crisis.
We use the CDC data. That is one of the most comprehensive data sets you're going to find that have questions on suicide and is giving a nationwide picture.
Suicide is the second leading cause of death for kids ages 10 to 14, and the third leading cause of death ages 15 to 24.
Why St. Louis? So I was doing this work initially in Uganda. And in the context of doing mental health work, I linked up with a colleague, Ryan Lindsay, who does suicide-related work here in the US. So suicide is not just a US phenomenon. It's something that, again, we're seeing increasing in adolescents, even in Uganda. So as we were collaborating on this project in Uganda, he talked about St. Louis, and he asked if we could work together on a program related to schools in St. Louis. I was like, that's exciting. I think it provides a lot of opportunities for cross-learning. We were going to work initially with a focus on youth of color, because the rates of suicide are increasing exponentially within these groups compared to other groups.
Having studies centered on the youth of St. Louis became the natural next step.
When we are looking at youth, if we are comparing by race, we see a lot of youth who are Black and other racial minority groups having higher rates compared to white youth. And then youth who come from low economic backgrounds are also most at risk for suicide.
Mutumba says one problem children everywhere face is negative influences from technology at their fingertips. In August, the family of 16-year-old Adam Raine sued OpenAI and CEO Sam Altman, alleging that ChatGPT contributed to their son's suicide, including advising him on suicide methods and offering to write the first draft of his suicide note. The Raine family launched the Adam Raine Foundation to raise awareness about the dangers of forming emotional dependencies on AI companions. This is part of the battle Mutumba is now facing with studies focused on St. Louis youth.
I know it's very scary to think about what, these tools, they can be very helpful, but generally I think what we are seeing is really, again, the ugly side to AI and how detrimental it can be, especially for young people. But I think what we really need to do is training these models. What safeguards are in place to help children? Taking these tools and putting them in much more controlled environments, training the models ourselves. So we're not depending on sort of tools that have been developed for the general population.
Through research, she's trying to learn as much as she can so that she can help provide the biggest impact for suicide prevention.
In finding what can we do, what sort of interventions can we do to address suicide risk? So in public health, we really think about working upstream. What can you do even before these symptoms begin to manifest?